Between 2000 and 2012, 99.6% of drugs tested in clinical trials for Alzheimer's disease failed. That's a higher failure rate than even cancer trials. But we have some of the greatest minds studying this disease, which, by the way, a new person will be diagnosed with every 65 seconds. So why do we still not have an effective treatment? What are we not seeing? Well, some researchers think that it's not necessarily the drugs themselves that are failing, but rather our ability to detect Alzheimer's early enough to treat it. So maybe we are looking at this all wrong. And when I say looking, I mean looking. My research is focused on the eyes. As we all know, the eyes and the brain are intimately linked. But did you know that visual defects, and not dementia, are often the first symptoms of Alzheimer's? What's more, hypervascularization, or the increased growth of blood vessels, that's been found to occur in the brains of Alzheimer's patients, seems to occur in their eyes as well. And there's another disease that's also common in the elderly population and also characterized by hypervascularization, this time primarily in the eyes: age-related macular degeneration, or AMD. My research involves examining the eyes of mice with Alzheimer's symptoms and seeing if I can find a link between Alzheimer's and AMD. So far, what I found is that the eyes of these mice have increased amounts of amyloid beta, the protein thought to be causing Alzheimer's and its associated symptoms. Now here's where it gets exciting. Our lab has previously described that amyloid actually increases the formation of leaky blood vessels in the brain. I found that these eyes have increased amounts of the protein that's associated with the formation of these leaky blood vessels, shown here in green. My next step will be to see an increase in the number of leaky vessels in the eyes of live mice and treating these mice with AMD medications. This should not only decrease vessel formations in the eyes, but could also reverse their Alzheimer's symptoms. Can you imagine? Instead of performing a painful lumbar puncture on an elderly patient in order to obtain cerebrospinal fluid, which is what we have to do today to diagnose Alzheimer's, we could just do a simple eye test, even before cognitive symptoms arise and treatment options might be too late. Or imagine using AMD medications to treat Alzheimer's as well. You know what? It might turn out that the eyes are more than just windows to the soul. They're windows to a future without Alzheimer's. Thank you.